Today, in this video, we will talk about electrolytes and electrolyte imbalances, particularly in a ICU setting. This video is better when it is associated with the presentation that I had prepared, so that you can follow the slides and what I am talking about. So, first and foremost, what are the common electrolytes that we are interested in and why are they important? The most important electrolytes that we worry about in day-to-day management of patients are sodium, chloride, potassium, and calcium and magnesium. And of course, bicarbonate is another, it's not exactly an electrolyte, but we do worry about it when we look at the acid-base balance. We will come to that later. So let us talk about these electrolytes and what is their importance in normal physiology. So first comes sodium. The normal levels of sodium in blood should be around 135 to 145 millimoles per liter. Now the SI units are millimoles and the old units are milliequivalents per liter. They can be loosely used as interchangeable ones because most labs do that. And for practical purposes, let us talk about millimoles per liter. And the sodium ion levels are high in the serum, whereas they are low inside the cells. Whereas it is the other way around for potassium. Potassium levels are high inside the cells and they are low in the serum. Now this is because of, if you remember in physiology, whenever a membrane stimulation comes through a nerve or muscle, the sodium channels open up and sodium enters the cell, so changing the resting membrane potential, which is at a negative level, and bringing it to the positive. And then the sodium potassium channels pump the potassium outside to the cell to balance it out in the immediate period. And then there are active potassium channels which later on pump the potassium back into the cell and sodium out of the cell. So this kind of arrangement where the sodium levels are high when compared to the potassium levels in the serum is a physiological phenomenon to aid for conducting through various tissues and for cellular activities. And here one important point what it spoke about is the sodium potassium pump. That pump accounts for the major part, up to 60 to 70% of what we call as basal metabolic rate. So whatever activity we do, most of whenever we are not doing any activity, still the body is burning some energy, and that energy is burnt on this channel which is called as a sodium potassium pump, which actively pumps potassium into the cell and sodium outside the cell. And this is a very important concept to have in mind when you are dealing with sodium and potassium ions. When do we start worrying about sodium? When the sodium levels go more than 150 millimoles per liter. That's when sodium will become important, and this is called as hypernatremia. And the clinical features of this will be thirst, confusion, and coma. And common causes of high sodium is water depletion. So someone who is dehydrated or he is hypotensive for any reason, and if they have not been taking enough water, or the body water has been lost because of diuretics, or sometimes giving excess of sodium also can cause this condition. If in a patient who has been acidotic, if we have been giving him lots of sodium bicarbonate, the sodium in the sodium bicarbonate solution adds up, and this can lead to hypernatremia. But this is not going to happen with a single dose of soda bicarb or with 1 or 2 doses of soda bicarb. It happens on a cumulative way over a period of time. Say for 3 to 4 days, if continuously lots of soda bicarb is being infused, that's when such a thing can contribute to hypernatremia. Now, what are the features of water depletion and high sodium? Usually they are associated with hypotension, decreased skin turgor, cold clammy skin, tachycardia, and raised hematocrit and uremia. The blood urea levels are increased in such situations, because what is basically happening, is the fluid content, the water content of blood or serum has come down, so the concentration of every other ion and atoms will increase, and so there will be a false level of increase in all the urea and creatinine. Common causes of low water in the body could be diarrhea, vomitings, sweating, excessive sweating, burns, and diabetes insipidus following head injury. Now, in the first few conditions that I have mentioned, diarrhea, vomiting, sweating, and burns, there could equally be loss of sodium, and hence these conditions could either lead to hyponatremia or hypernatremia, depending on the prior electrolyte status of the patient. Now, what is the treatment for this high sodium? And if the sodium levels continue to increase, what can happen? First of all, let us talk about that. If the sodium levels increase to beyond 160, then it can start affecting the nervous system. Patients can become confused, and or they can also become comatose. And it is very important to identify this condition, because if it is a subtle thing, and if regular sodium levels are not measured, patient slowly goes into a coma, and then we are still wondering what could be the cause, and you will be doing CT scans and other things, whereas they are not the primary cause of hypernatremia. We'll stop it now.